you?
All right, so the worst part of this deal is the numbing medicine, all right? You're gonna feel a little pinch and a burn. Was this ever treated before?
You did. You actually.
We removed it, or we?
Years ago.
Yeah.
You didn't.
We shaved
You
it,
shaved
right?
it. You said it's gonna come back.
Yeah. That's what it
Back
looks
to
like.
me in a few years when you feel like you can't take it and you don't want it.
Right, so we're doing that part.
That's what we are.
Amazing. Even 6 years later, I still say the same spiel.
Let me use your words like barnacles.
Yes, yes. How you been otherwise?
Well, thanks.
Good.
I'm trying to make these lifestyle changes with the diabetes.
Are you on any of those GLP
No.
situations?
No.
Have you talked to your doctor about it?
I have.
I'm
considering it now.
I mean, they're really a game changer, man. It's like,
Yeah.
it's like.
I just don't know what the side effects are on the body.
Yeah, well, they appear to be like, listen, nobody knows, to be honest with you, right? But they appear to be like very safe, and they also appear to have like lots of like tangential like benefits.
Like heart related.
All kinds of stuff, heart and brain. I mean, it's like
all
every
sorts.
organ system. It's hard to know how much of that is actually like.
Right.
I see it's in marketing. Yeah, it's hard to know like
Right.
how much is true and how much is propaganda. But what I can tell you is like just through the years, man, I have like patients that I see them once a year for skin checks, and like I don't even recognize them after a year. Like it's insane. And everyone I'm trying to do thousands of patients around them at this point. And like I haven't heard one person say, "Oh, this horrible thing happened to me." I mean, that's based just listen, it's a very small subset of patients, but from what I gather, I mean, they seem to be like incredibly effective.
With curbing the appetite, I guess.
Yeah, totally. But they also like modify the way like your insulin works and your glucagon works and all of the hormones.
All that.
Yeah, and part of it is the appetite issue, but it doesn't really. That's not. There's a lot of other things going on behind the scenes, basically. Yeah, like from a science perspective. I think you should be pretty numb. You're gonna feel some pressure. You shouldn't feel anything sharp or painful at all.
Okay.
If you do, just let me know. But listen, establishing those lifestyle habits like you're doing, that's really the key.
That is the key.
Even with like if you were to do one of these other things, you okay?
Yep, so far so good.
Because that's what's gonna keep a sustained.
Right. So I do come off the medication, then I want to be able to sustain.
Yeah, exactly. And what a lot of folks do is like so the medication is supposed to be taken like every week, but a lot of folks will take it like that way until they hit their goal, and then they use it every other week or like every third week. It's like then a lot of folks are sort of figuring out the nuances,
Are the majority of them using what is it, Ozempic?
It's whatever's covered.
Whatever's
yeah, so it's like
As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these two amazing Dr. Mudgil brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do.
I have patients on like all of it, every different one. Yeah. All right, so we're gonna put the stitches in. Stitches in for 2 weeks.
Okay.
You can shower, can get wet, work out all that stuff. Just Vaseline or Aquaphor over the stitches.
Okay. Right.
And then 2 weeks come back and take the stitches out.
So no bandage on it.
We're gonna put a Band-Aid on it, just like a regular Band-Aid. Yeah. So the Vaseline or Aquaphor and then a Band-Aid over it. You okay?
Yep. So I should feel this later on?
It'll be like very minimal. Yeah. I mean, if you do, you can take some Tylenol or whatever, but you probably won't even need to.
If you're feeling the music we used in this video, you can go to the description below and click on the link to the Doc's YouTube playlist.